Scrambler therapy. Is this the answer to your nerve pain? Well, today in this video, we're going to help answer this important question. After seeing thousands of neuropathy patients suffering from painful burning in their hands and feet, tingling and numbness, I literally never thought I'd see somebody throw away their cane, throw out their pain medications after just 5 treatments until we brought the Scrambler technology to San Antonio and I could see it for myself. So I'm going to share something that changed how I view neuropathy treatment forever. So about 6 months ago, a friend called who had developed severe neuropathy after undergoing chemotherapy from prostate cancer. About 18 months after he had undergone the chemotherapy, he started feeling the burning, the numbness, and the tingling in both his hands and his feet. He was prescribed the typical regimen, gabapentin, and then Lyrica. And after these treatments had started to fail, he was talking to his pain doctor about a spinal cord stimulator. The medications left him with terrible side effects. It was difficult for him to drive. He had extreme drowsiness and had a lot of sexual dysfunction, so it was difficult for him to be intimate with his wife, so he knew he had to do something. After he'd researched extensively, he found a breakthrough technology called Scrambler therapy, and it was only being done in Dallas and Texas at the time. So after just 7 sessions, he went from taking daily medications to being completely pain-free for almost an entire year. As a chiropractor who's treated thousands of neuropathy patients, I knew this was literally completely unheard of with conventional treatments. That's why I knew we had to bring the technology to San Antonio. So today, I'm going to explain exactly how Scrambler therapy works, show you real patient results, and share why the nation's top medical institutions are adopting this revolutionary new approach. So let's start by understanding why conventional neuropathy treatments so often fail. Whether your neuropathy is diabetic related, chemo-induced peripheral neuropathy or CIPN, or an unknown cause called idiopathic neuropathy, the underlying problem is damaged nerves sending faulty pain signals to your brain. This happens when there is damage to the insulation sheath of the nerve called the myelin sheath, or due to ischemic change, meaning a lack of blood flow to the nerves. The biggest key to treating neuropathy is ensuring the underlying cause of the damage is being well treated and not continuing to cause more damage. So in the case of diabetic neuropathy, we want to ensure that your blood sugar levels are closely monitored, that they're stable and they're within the normal range so that more damage isn't being done to the nerves. Once we have the root cause under control, most doctors respond by prescribing the typical pain medications, neuropathic pain medications, gabapentin and Lyrica. These are also known as Neurontin and pregabalin. While these can provide some relief, they obviously come with serious downsides. First, they of course only mask symptoms rather than addressing the root cause. I like to use the analogy of sticking a piece of tape over your check engine light. The underlying problem continues getting worse. Second, the side effects can be devastating. Most patients report feeling constantly drowsy and dizzy. A lot of patients complain of significant weight gain and they don't even want to take the pain medications. There is a lot of sexual dysfunction. It's difficult for men to have an orgasm on pregabalin or Lyrica. I've had patients tell me that they feel like zombies taking these medications. Third, these medications often become less effective over time, requiring higher and higher doses. Eventually, many patients are told they only have one treatment option left, and that's a spinal cord stimulator. This is an invasive, permanent device that can cost upwards of about $150,000, and it comes with, of course, surgical risks. This is where Scrambler therapy takes a completely different approach. Instead of masking symptoms with medications, the machine uses 16 sophisticated algorithms to generate a new artificial nerve signal to retrain your brain's perception of the pain signals. So let me explain how this works. The technology was developed by an Italian neuroscientist, Giuseppe Marineo at the University of Rome, after 30 years of studying neuropathic pain. The machine received an FDA approval in 2009 and is now being used at institutions like the Mayo Clinic, Johns Hopkins University, UCLA, MD Anderson Cancer Center, and the Cleveland Clinic. So think of this like teaching your brain a whole new language. Right now, your damaged nerves are speaking a pain language to your brain. Scrambler therapy teaches your brain a new no pain language to replace the damaged signals. We do this by placing small electrode pads in areas above where your pain is located. These electrodes deliver 16 different artificial nerve signals that your brain interprets as normal, no pain information. Over a series of treatments, your brain's neuroplasticity allows it to adopt these new signals as the default new no pain signal. Neuroplasticity is simply your brain's ability to learn new information over time, such as learning a foreign language. So here's what makes this truly breakthrough technology revolutionary. Patients typically experience significant relief and oftentimes complete relief during their very first 45-minute treatment. It's hard to believe, and I didn't believe it until I saw it myself. We can literally demonstrate in one session what life could be like without neuropathy or neuropathic pain. So let me share a recent case. A patient named Robert came in using a cane. He was unable to feel his feet almost at all while he walked. He had terrible balance, and this was due to significant nerve damage from over 10 years of diabetic neuropathy. His pain levels typically were about an 8 out of 10 at night, making sleep almost impossible without pain medication. During the day, his pain was better, but it was mainly the night pain as far as why he took the medications. After a single treatment, the spongy feeling in the bottom of his feet had almost completely disappeared. He walked out of the first session holding his cane. He literally wasn't even using it for balance. I literally was astonished, and I could hardly believe it. It looked like a completely different person when he walked. His balance when he would get up and down from a chair was so bad that I would have to hold him every time he stood up because I was literally afraid he was going to fall over. And to see him walk 30, 45 minutes later when the treatment was over without his cane, I literally almost couldn't believe it. After the first night, his pain was about 50% less intense. By his fourth treatment, he was nearly pain-free for almost 24 hours. After completing 2 weeks of treatment, he no longer uses a cane. He doesn't use his pain medications. His numbness has significantly improved, and he's sleeping through the night without the pain medication. So what does this treatment process look like? First, we do a thorough evaluation, including your medical history and a full physical exam, including a neurological exam. If needed, we can perform nerve conduction testing in the office to precisely identify the source of your pain. Treatments are performed daily, Monday through Friday, until you achieve lasting pain relief for more than 48 hours. So this typically requires on an average of about 10 sessions. Each session lasts about 45 minutes. There's no pain, there's no downtime. You can drive yourself to and from the appointments and resume all normal physical activities immediately. Most patients experience significant relief and lasting relief for 6 months or longer, sometimes upwards of a year after completing just an initial course of treatment. Some patients, of course, will go into full remission. So if the symptoms return or when the pain returns, patients will typically go through 1 to 2 sessions of a tune-up in order to restore their relief. So the treatment is, of course, extremely safe. There's virtually no side effects. The only contraindications to treatment are pregnancy, epilepsy, patients with spinal cord stimulators, and obviously cardiac implants. So I understand the skepticism. After years of failed treatments, broken promises, it's very hard to believe that something could actually work. But this technology is being used at the nation's top medical institutions for a reason. It's providing lasting relief without medications or surgery, and it's safe. So let's be clear, it's certainly not a miracle cure. It doesn't work for every single patient, but 80 to 90% is absolutely remarkable for treating these really difficult neuropathic pain conditions. So if you're suffering from neuropathy pain in the San Antonio area, or you live in Central or South Texas, I invite you to experience this treatment for yourself. We're offering a $19 consultation where we'll perform that complete history, physical examination, neurological exam to determine if we think you're a good candidate for the Scrambler therapy. So don't let neuropathy pain control your life any longer. especially when the solution is available right here in San Antonio. Call today to schedule your consultation. We have limited availability, so call now. We can only treat so many patients on the Scrambler per day. So we'd be honored to help you get your life back. Thank you for watching. Check out our other YouTube videos. Like and subscribe if you'd like to learn more about non-surgical treatment options for your pain.